Hello, this is Angela Niday. I'm going to spend a few minutes with you today talking about an ethical issue in psychiatric nursing, electroconvulsive therapy, or ECT, a more widely used psychiatric treatment that's still fairly controversial. Now, we all probably have some theatrical ideas about what ECT looks like, but the actual clinical presentation might be quite different. The patient is most likely there voluntarily. They are sedated with anesthesia and given muscle relaxants. The procedure itself elicits an electric current through the brain. This causes the seizure, which lasts about a minute, and the patient actually exhibits no outward signs of a seizure, unlike what we're used to seeing maybe from the movies. It's still not widely understood how ECT works. Seems to be related to changes in the chemistry of the brain. Studies are showing that ECT works better than medications. It's typically used for short-term treatment of severe depression. It's been shown to decrease the risk of suicide. It's used in the catatonic patient who may be not speaking, not eating, maybe unable to find pleasure in any activities. Also used for severe mania and bipolar, as well as some forms of schizophrenia. So maybe we can understand why people would opt in for ECT, but what about the involuntary patient? These are the folks who aren't able to give informed consent, primarily due to the severity of the mental illness. This is rare, only about 1 to 2% of the ECT patients. Washington State has some legal authorization to court order this treatment in cases where all other options have been exhausted, and in doing so may save their life. So we're needing to consider the ethics around ECT and whether the principle of beneficence, or doing good for someone, overrules the patient's right to autonomy, in which they have the right to make their own decision. So this court-ordered treatment, the documentation, what does that say specifically? So there's an indication that the patient's gravely disabled, in which psychiatric providers and the care team have determined that they're unable to voluntarily consent. They might be catatonic. The lesser restrictive treatments like medications haven't been effective to treat, that the patient may commit suicide, and or the medical team is ethically obligated to do so to act in the best interest of the patient. Now, I mentioned beneficence and autonomy, and in the case of ECT, we're needing to consider the alternatives to treatment. If the alternatives aren't working, what can we do to protect the patient? Now, the most common side effect with ECT is memory issues. There's some impairments, which, if looking at the big picture, is minor when comparing it to the symptoms of the psychiatric condition. The ethical principles of non-maleficence and beneficence in this case would refer to our commitment to the patient in weighing the benefit versus the risk, memory issues versus grave disability or even death. So could we potentially be morally or legally negligent if we don't consider ECT as a treatment, especially in patients who meet the criteria, considering the rights of the incompetent patient to receive the most effective treatment? It's important to consider our own preconceived notions of what this particular treatment looks like. We've come a long way since this very popular movie depiction of electroshock therapy. So what are the alternatives? The medications aren't working. Side effects to medications aren't tolerable. Patients are needing faster treatment options than the medications They can take weeks to start working. So I might have given away my own personal feelings about electroconvulsive therapy. And though I have no personal experience with its use, I feel strongly about doing something, anything, to help people live a functional, meaningful life. We as nurses are responsible for assisting with medical treatments and removing ourselves from a position in which we're forced to question our own personal values. In the case of ECT, I feel that I have a lot more to learn, and science has a lot more to learn, but if it means saving a life or giving a life to someone, well, I'm on board with that. Thank you.